I just want to talk a little bit to you about the fact that it does feel one of the best bits of news to emerge more recently is that if you are admitted to hospital with COVID-19, you've got a much better chance of survival than at the beginning of the pandemic. So back in March, 66% of people hospitalised with COVID worldwide survived, compared to 84% in August. Why do you think that is?
We don't know for sure why that is, but we can speculate. If you think back to sort of February, March time this year, we were facing a new disease. We didn't know how people responded to it. And we were trying to learn from people around the world, particularly China and Italy, about their experiences. So we were faced with the unknown. We were also faced with a huge influx of people who were sick with it, who were coming to hospital and requiring critical care. And that put huge pressures on our capacity, both in terms of physical space, but also staffing as well. And what's happened over that period of time is that we've learnt about the disease. So we know how to treat patients earlier. Initially, we used to put patients straight onto mechanical ventilation. So we bring them to intensive care, sedate them, and put them on ventilators. But we slowly started to realise that perhaps we could manage some patients without doing that. So using other modes of ventilation, what we call CPAP. Which is all the space helmet type equipment that we've seen in the media. Um, and so we were able to reduce the number of patients that required mechanical ventilation, and hence that probably had an impact on outcome. But again, what we've seen is the demands on hospitals and critical care meant that we had to change our approach to delivering care to patients. And as the pandemic went through its course and we look at mortality towards the middle to end of July, um, most intensive care units will have been back to their normal staffing ratios, which meant we were better able to provide the same standard of care that we would normally do. So it's probably a combination of things, but there is no doubt that if you become sick with COVID, if you come into hospital, and certainly if you are admitted to an intensive care unit, you have a much better chance of surviving now than you did at the beginning of the year.
Yeah, genuinely sort of good news, reassuring. There has been some speculation that it could be because the virus is mutating to become weaker, or because people are getting a lower viral load because of social distancing. Do you think either of those things could be having an impact as well?
I've not heard anything that would suggest that the nature of the virus has changed. Um, I'm sure that as Sir Jeremy just mentioned, that many people are actually listening to the guidance. We're not socialising as much, and that will have had an impact in terms of community transmission. Um, but it is still a very deadly virus. So although the majority of people still who become infected will have a very minor illness or may not even know that they're ill at all, for those people that require hospital admission, for those that come to intensive care, it's still a very severe disease. And we certainly see in critical care that patients are extremely sick. And we've seen the images on TV from inside Liverpool Hospital, um, that that the staff are working really hard. Their patients are really sick. So it is important that we appreciate that the disease is still there. It's still severe, and if you end up in critical care with COVID pneumonia, you're almost twice as likely to die than somebody who's admitted with a pneumonia not due to COVID. So it's still something to be worried about.
Really important distinctions there. You were talking there about the situation in some hospitals in the areas that have been worst hit more recently, because hospitalisations really are starting to tick up again. So what is the situation in intensive care, and how concerned are you about NHS capacity? Because we have heard of some hospitals in Nottingham, Liverpool, already beginning to cancel non-urgent appointments.
I think it's very different around the country. And we've seen the hotspots on the maps that we see on the media, and certainly the northwest and northeast, Yorkshire and Humber, parts of the Midlands are affected, and Liverpool in particular, as we're all aware of. And in those critical care units, what everyone is trying to do is, unlike the first wave, where almost all normal NHS activity was stopped apart from urgent and emergency care, we don't want to see the unintended consequences of that during this next wave. So we're trying to make sure that we have safe pathways for patients with COVID and those without COVID, so that we can continue to treat everybody that needs to come to hospital. So what that means is, in intensive care units at the moment, not all of those patients will be sick with COVID, because we are continuing to do as much normal activity as we can. But unfortunately, if COVID continues to rise in terms of community transmission, that is by definition going to translate into more patients in hospital and more patients in critical care. And therefore, the only way we can do that is by stopping non-urgent care. And so the consequences, again, this time round, isn't going to be on COVID patients getting access to healthcare. It's going to be for those patients that don't have COVID. So it may well have an impact on people who have chronic ill health, who need to have surveillance. It may be pregnant women who need antenatal care, who may be scared to come forward because they don't want to either risk becoming infected, or they don't want to overburden the NHS. And that is the one thing that we want to avoid this time. So if we can keep community transmission down, it means that we can treat everybody that needs healthcare. And that is the great desire for everyone working in the NHS at the moment.